I'm Laura Blumenthal on the Berkshire Heroes podcast, and joining me today is Debs Morrison, the CEO of CLASP, the charity which is a self-advocacy group for those with learning disabilities. Welcome, Debs.
Hi, good afternoon to you.
I know that you've been at CLASP since 2019, but you had a long and successful career in the aviation industry before. What made you decide to switch from the business world to charities?
I suppose in lots of ways I've had enough of industry. I have spent the last 20 years not really ever being at home, just flying around the country, which always sounds glamorous, but really is not, in a very male-dominated industry, which makes it even harder. And I suppose in a way I was fed up with fighting for equality, fed up with the travel. My VP was leaving, who he was a great man and he really welcomed my emotional intelligence inside the organisation, and I just felt that might go when he went. I had met a new man in my life, and we were going to get married, and so the timing all seemed right. My mum was getting older. I had my first grandchild, and he sort of had a lot of empathy for me and said, "I don't know why you're doing this now. Give it another chance." And I was so lucky. I'd not long lived in Wokingham. I always get the Wokingham paper, Wokingham Today, and I opened it up and there was a job advert in there for a manager for this charity that I'd never heard of. And the lady that interviewed me, who was then the company secretary, was really forward thinking because I had applied for jobs in the charity sector before, but they think, oh, you're overqualified. And she just saw the vision that actually I could grow the charity and make changes. So it was just a really good sort of everything being aligned together. So it was obviously always meant to be. So yeah, I moved.
Everyone loves someone with a vision, that's for sure. Tell me a bit about CLASP. What does it do? Who does it help?
Well, when I started at CLASP, we were very, very small, and the lady that still works for me, Anna, who's fab, would say that she thought it was going in the very wrong direction. And I treated it like a business. I think lots of people treat charities like it's a second-class organisation, but for me, it was about, running it like an organisation, a business. Um, Although we support adults with learning disabilities, I didn't spend lots of time trying to understand all their different diagnoses because actually they want to be treated like adults and recognised as adults in everyday life. And so for me, it was about just helping them achieve that. So we do a lot around, we've got 280 members now, and we support their families. One of the things, if you talk to anyone from class, they would say is about friendship groups. That was never really our initial intention, but there has been some lovely friendships made through CLASP, which makes them feel they belong and they're not judged and they feel safe in our environment. So from that, we get to know an awful lot about them, awful lot about their lives, which then helps us signpost appropriately. But also, I think for us, we do everything. So today is a typical day where we used to only meet twice a week for 4 hours. Now we do something every day of the week and occasional bits and pieces at weekends. But today we've already this morning had Happy and Healthy Club in partnership with Places for Leisure in Wokingham, where they did walking football, and that's part of us helping them to maintain their health and well-being. Now they're coming in and they're going to do a craft session, which is very creative. It's amazing what they do. We're going to have an art exhibition this year because I'm so impressed with the things they do. It always makes me smile. And then this evening we'll have a social evening at the Sadira Lounge. Um, so we do everything from education to raising awareness to campaigning. I mean, it's huge, this sort of variety of activities we do within our organisation. We're always mindful of the whole gambit, I suppose, really, from helping them with their independence and giving back the best possible lives they can and giving back to our community in whatever way we can.
Now, I saw an astonishing fact on the MenCap website, which said that on average, women with learning disabilities die 23 years younger than women in the wider population, and for men, it's 20 years. What is driving this?
Well, the sad thing about that fact, Laura, is they're all preventable illnesses, so they're all avoidable deaths, which is absolutely shocking. It's driven from loads of things, from very practical barriers, like they can't actually get the transport to get them to appointments, or you have to ring your doctor at 8 o'clock and they may not have care and support at 8 o'clock, so they can't actually ring their doctors at that time. The system to ring the doctors is too complicated. I was just in a meeting earlier actually where we were talking about ringing somewhere where you have to press one, then press five, and then press. That's all too complicated for them. There's not that point anymore where you can walk down to a doctor's surgery and make an appointment, so they really struggle with the information that's given. It's not accessible. There's a lack of understanding, I think, within doctors' surgeries about what it's like to have a learning disability and those small adjustments you can make to make it easier for people to access the service. So that in itself makes them anxious and they're less inclined to go. Services aren't joined up in the right way. Sometimes they've got no one to take them to appointments or no one to advocate for them when they're there. So I think there's a whole range of those practical issues. CLASP made a video about 3 years ago with some grant funding we had to use in primary healthcare to raise awareness of what it's like to have a learning disability, made with lived experiences and made with a fantastic GP based in Kintbury called Dr. Heather Howells. And we've really struggled to get GPs to engage with us on that video. We've tried everything. We've done leaflet drops. We've walked in and talked to people. There doesn't seem to be, in many practices, anyone that's aligned to looking after adults with learning disabilities. So it's really hard to get that level of engagement. And some of the things that they die from are things that are completely preventable, like constipation. Because of their medication and everything, they really struggle with their toileting habits, and they don't understand what that means. They would be very fearful of going for a smear. They'd be very fearful of going for uh, cancer checks. So we do lots of work around that. We offer sessions on constipation, good health, dental health. Just to try and take the fear factor away and make it like a normal part of every day. But then if they actually struggle to make the appointment, they're a lost leader really. And also there's lack of follow up with them. So you'll have well, we've supported people unfortunately who have died as a result of very, very manageable illnesses where they've been very, very poorly, lost lots of weight. They can't get to the doctors. When they get there, they find out they've already got a stage 4 cancer. It's shocking. That is, for me, that's one of the biggest drivers for me within in CLASP is to try and get more equality around health, which is why we work so hard on the healthy eating, the awareness raising, but we can't actually physically be there to get them to help them ring the doctors or to get to the doctors, or so we try and do it every other way. But actually, if doctors don't want to engage, that makes it a really difficult ask.
What strikes me is that all of this, it's not very difficult. It just needs
No,
someone who's a champion in a particular surgery or someone at NHS to take responsibility for it and take the load off GPs because we know they've got so much to do.
absolutely.
But why it's not being done in 2025 is beyond me.
Well, our video we did was not to say to doctors, these are all your burdens. It was to say to primary healthcare, we're here to support you. So actually, lots of our members, if they can go to the doctors, will go for a poorly thumb or a headache or whatever it looks like. And we've done lots of work with them about, we work with the South Ambulance Service about, who you should call and when you should call the ambulance service. We've had pharmacies in talk to them about all the range of services for pharmacies. But the whole point of our video into primary healthcare was to say, we're not here to burden you. We're here to say we offer all these range of services, signpost people to us. But actually, if you had one person on reception or an office manager that could actually create a quiet space or ring somebody before their appointment to make sure they come, to remind them, then actually that would relieve lots of your burdens. But yeah, it is a really difficult ask, and it's a very frustrating for me to try and actually get any level of engagement with those services.
And when it comes to employment for people with learning disabilities, I know it's a challenge for a number of people. What do you see locally working that's really good at getting people's foot in the door and getting them into the world of work?
We're quite fortunate in Wokingham. So the national average, I think, is only 5% of people with learning disabilities are in work, but in Wokingham it's about 21%. And there's a couple of agencies that work really hard to support people. So Optilis Supported Employment is one of them, and we work closely with Donna Morgans, who heads up that team. And that is about, they have job coaches, they find the right jobs for people. They also have their own ability cleaning that we employ here at CLASP, and they have ability catering, so they do catering. So not only do they offer opportunities for people, but they also support people in workplaces. I think that's really helpful. And I think it's really interesting about the different people we see that go into work and those that don't. And lots of it's about enabling. So it's about giving them confidence. So one of the things I've done since I've started CLASP is if we're doing a campaigning group and we're having a discussion, I encourage the members to come to the front and talk and like present almost their findings back, because I want them to recognise they've got lots of abilities. It's not about disability, we're ability led. And so it's all about how do we get them to gain confidence and how do we get them to feel that they're going to be valued and they can walk into that sort of work community and feel like they're going to be a valued member of the team. We've got one member who's worked for Sainsbury's for 25 years, another that's worked for Wix for about 5 years now, and he's got Employee of the Month. We've got another member that works for Asda. So they are very employable, and also often if the tasks are very repeatable that people like other people might find boring or tedious, they actually thrive in those sort of environments, and that's not to demean them in any shape or form. Um, but they like repetition, they like things to be the same, they like their structure to be very structured. So I think we're missing a trick really if we often think that they aren't capable. But we are, like I say, we are very fortunate in Wokingham. We absolutely buck the national average with the number of people. And we employ 2 people in CLASP with learning disabilities, and we encourage lots of our members to be helpers. So they may come to sessions and put up the tables and chairs. They may hide the chairs away. We work with Cowshed doing volunteering. We started off doing it with our members, but now 2 go every Monday on their own, stand on their own 2 feet. We do volunteering in local churchyards, helping to clear up, mow the lawns and clear up the graves and everything. So we're always encouraging them and and praising them for what they do. That's really important. We want them to live their best possible lives in whatever way is suitable for them. So yeah, it's having more people doing the same thing, I think.
Glad to hear we're doing well locally. Housing is a hot
Hmm.
topic locally, of course. What does housing provision look like for those with learning disabilities? Is there the right housing, the right support available for them?
We do lots of work around housing. We have regular workshops with the housing team. The first barrier is getting on the housing register, and because whether you've got a learning disability, you're elderly or not, the form is the same for everyone. And I tell you, I tried to help a member fill in a form and I could not do it. I absolutely could not understand the questions and fill them in. So we're currently working with Wokingham Borough Council on making it more accessible. It's really, really tough to actually complete the actual basic form. We encourage people to make sure they're on the housing register even if they live at home currently, because actually that's the only way the council can forward plan to have the right accommodation. But actually in Wokingham, I think it's something like 88% of people live either with their families or in independent living to a degree. So that might be within supported living where there's background support. There's a place in Wokingham called Beeches Manor. It's very close to the town and it's a perfect arrangement for lots of people. You've got your own flat, but there's somebody on site all the time, and you bring in your own support when you need it, whatever that looks like, 2 hours a day, 1 hour a week, whatever it might look like. More of that is what I think is required. But for me, the frightening thing I think is the number of people that have cared for their LD adult for years and years and years and feel that's their responsibility, and we don't know about them. So Wokinham's got the highest number of adults with learning disabilities in the south, but we also know that probably only a third are actually registered. Nationally, it's known there's loads more. So if you think you've got over 600 in Wokingham, that actual number could be more like 2,000 at
Why
home.
is that, Debs? Why do we have such a high proportion
I
of
don't
people with
know.
learning
I've asked that
disabilities?
I've asked that question lots of times and nobody knows the answer. Nobody knows. There's theories around the fact that we're quite a blue chip population around here, and that actually that can obviously lead higher intelligence, might lead to some I don't know abnormalities. It's not known. It really isn't known. Or it could be the fact that actually we are a very attractive borough to live in and have been for a long time. That lots of people come here because the provisions are very good, or were very good for adults with learning disabilities. So it seems quite a safe place to live to get support, which is obviously being downgraded all the time because of the pressures.
Is it because diagnosis could be better now and Wokeham's quite good at that?
No, well, I mean, diagnosis is poor still. The waiting lists are really
You're
poor
right.
still. Doesn't matter. That's that. I mean, I don't know what it is nationally, but it's still a long, long waiting list to get diagnosis. I think it's better if you've gone through school into adulthood, because I don't think many people will leave school without a diagnosis of some sort. But lots of our members are in their 30s and 40s that didn't go through that sort of system when SEND was a lot is now a lot better at making sure people leave with the right diagnosis. Have still don't have a diagnosis. We had a lady in her 60s that I got to know them because the brother came to me and said, "I'm really worried about, the provision when our mum dies," and she'd been going to the same doctor's surgery in Wokingham for 40 years, and she was very clearly had a learning disability, but they hadn't put her on the learning disability register, and they wouldn't unless she had a diagnosis. So then they had to pay privately for her to get a diagnosis so that she could be put on the register.
That's unbelievable.
It is
What
unbelievable.
what do you think people get wrong about those with learning disabilities? What are the misconceptions and what do you wish people knew?
Well, I think it's a fear thing, maybe, that they may look different, they may present themselves in a different way. And that is a lack of education, isn't it? That says we are actually normal individuals, whatever normal looks like. We just have our differences in the way we present ourselves, or what we need to function properly in society. Um, I think that one of the things CLASP does is it works really hard at raising awareness of what it's like to have a learning disability. It also works really hard at making sure we're out in the community. So we'll do sing outs outside Waitrose, for example. Last weekend we had a barn dance with All Saints Church, so we were mixing with local parishioners, and it was just fab because it's barn dances are very normalising because who knows their left from their right and everything. But actually, it just shows that actually we all have different skills and we all do things differently. But I think the misconception is about the disability versus the ability, and it's actually we're very ability led. Disability is only a term you might use when you want to get you claim your PIP or get your mobility badge or something. We're all about what abilities have we got to take our lives forward and actually contribute to society. So I think our members suffer a lot from hate and hate crime. People can be very cruel in Wokingham and around our borough, which is really shocking. But I think most of it is stemmed from the fact there's that fear factor and it's something different and they don't understand, which is why we're so keen for people to engage with us, whatever way that may look like.
And CLASP obviously does a really good job supporting people, but what other support locally is there for people with learning disabilities and their families? And what does CLASP do particularly to support the families?
We're very much a signposting organisation, so we realise we can't do everything ourselves. And coming from industry, I hate duplication. So if somebody else does it or they do it better, they can do it. And if there's somebody we can partner with, absolutely fantastic. So there are some really good agencies and organisations in Wokingham that we try and work very closely with. So we run the Learning Disability Partnership Board for Wokingham Borough Council, and in that board we have representation from health, from support agencies, from Optalis, as I've spoken about, for support and employment. We have members from Pink, which are an organisation that used to be MenCap, but they support carers and their families and people with learning disabilities and autism. And we all come together at least every other month to talk about the current challenges or the campaigning we want to do. We CLASP produce a newsletter every month to over 600 people that are in the industry. So it could be social workers, it could be families and carers, it could be just people that have an interest from the Autism Society. There are lots of services out there that are tailored in different ways, and I think we're quite fortunate that we all know each other quite well, and so we're all very good at supporting each other and signposting in different areas. Obviously, there's always more that can be done, but I think one of the challenges always is that we're all under pressure at all times, and that isn't just pressure for money, that's one thing, but it's pressure for space, um, it's pressure for facilities. We've been trying to get a community kitchen off the ground for goodness knows how long now. We've had some funding for it, but we just can't get it going. And one of the things for me is it's all right telling people about what a good diet looks like and helping them and educating them, but actually let's show them how to cook. Let's show them how to make that food that can be very straightforward, very simple, at a low cost, and that they can go away and they can replicate that back in their own home. You know, there's lots of things that I'd like to do, but we just don't have the facilities and all the people that help us move that forward. So I think for me, I think we do a great job, but there's always more. And I think that we do know our environment very well, and we do know the appropriate people to signpost to, and we have a really good partnership relationship with council to be able to go to them as well when we've got problems. As you can imagine, I don't let anyone get away with anything.
No, I'm glad to hear it, Debs. Definitely need you fighting in the corner.
Yeah.
And then what are you focusing on now, and how can people find you online?
So it's our 20th anniversary this year. So we're focusing on that this year. So the members are all challenged with doing a pledge of 20 something. So I'm walking 20 miles a week for 20 weeks, but the members, it could be arranged things. So one of them's doing 20 new vegetables across a period of a year. Somebody's doing 20 new recipes. Somebody made some lovely beads and you put them under an iron. My member made
Oh,
20 of
like
those.
hammer beads.
Hammer beads, that's exactly the
Oh, I
word, hammer
love those at
beads. Yeah, I
school.
know, I know. Somebody's made 20 hammer beads creations. Somebody else is learning 20 new songs. So it doesn't really matter. So there's 20. We're doing a pledge for 20, of which we've got a website where people could um, donate some money. And the other thing we're doing is 20 new experiences. So as CLASP, we're giving about 10 new experiences and encouraging the members as groups or as individuals to go and do 20 others. So we've had our barn dance, we're doing the disabled regatta, Henley Regatta, we're going to do some bell ringing, some Morris dancing, we've got a karaoke, and then we're doing our variety show this year as well, which is at the Whitty Theatre. So it's an exciting year. It's sort of driving everything we're doing really is around our 20 somethings. So I thought the year would flow really well, and I'd be putting my feet up because I've forward planned it, and obviously it isn't. It's just chaotic.
Debs, you've got so much going on. This is incredible. So, if people want to come to the performance, they want to come to the exhibition, how do they find out about it? Where do they go?
So everything's on our website, which is clasp@wokingham.org, or they can ring our office. We're based in the community hub, which is in Denmark Street, just below a citizen's advice. So they can always call in there. We're in the office Monday to Friday. So if they can't get to the websites or use information like that, they can come in and see us. So yeah, we're always open to new suggestions from people that we want to partner with. If anyone thinks they have a community kitchen and they'd like to work with us on that, it'd be fantastic. Yeah, we're always open to new ideas.
And finally, Debs, if you were Prime Minister, which law would you introduce or change and why?
I thought about that long and hard because there's so many things, as you can imagine. But I think for me, the foundation of the things that go well in our sector is good support workers. And so for me, I'd like to see them being recognised within the primary care sector as part of like pay scaling for the NHS. They're paid poorly, which then means you get a very mix of good support workers and not so good. And the good support workers make such a difference to the lives of our members, but also their families and their independence, which is what it's all about. So I think for me, it would be to recognise their value and make sure we celebrate their contribution to the actual overall health of our nation, which we do not do at the moment.
Here, here. Well, thank you so much, Debs Morrison, for coming on the Berkshire Heroes podcast. It's been lovely talking with you.
It's been lovely talking to you too, Laura. Thank you.